very pleased to have here Dr. Barbato with me for a short interview at the EuroPCR. And Dr. Barbato has been involved in all the early developments also of the QFR, working in Aalst and with CT. Yeah. You have an enormous experience in all these imaging techniques. So you are also now in Naples, involved in the QFR. Where do you see the opportunities for the image-based analysis for the physiology?
You know, one of the main limitations in the applied invasive physiology in our daily practice has always been related to possible obstacles in implementations. You know, people has alluded to the use of adenosine, to the availability of the pressure wires, to budget restraints actually. What QFR offers and functional imaging offers is the overcoming of these limitations, giving at disposal, actually making at disposal of the interventional cardiologist a tool that, together with angio, would also provide the functional impact of the coronary stenosis observed at the angiogram. Angiogram is something we would do anyhow, and
yeah.
if with that comes also the functional assessment of the coronary stenosis without the need of further opening up another device, using up other tools, so our cath labs, why not? I mean, that has big promises of increasing adoption of physiology in the cath lab.
And of course, we are also very excited about QFR, but at the same time often forget there is also anatomic information.
Right.
It's 3D anatomic information. We have the stenosis length, we have proximal diameters, distal diameters, all kinds of reference diameters, all kinds of parameters that are available, and we often forget about it.
We don't use them actually.
Yeah, exactly.
But these are integral part of our decision making actually, because together with the functional impact, the next step would be procedural planning. How do we tackle this kind of stenosis? So by having all these informations integrated, that would certainly enable the interventional cardiologist to take a more informed decisions and a more, let's say, reasoned planned treatment for the patient.
Yeah. And of course, we have shown already that with so many studies that the QFR has the same value as the FFR, no systematic differences. But of course, now we need to do also an outcome study, because that is in the end to really show to the community that it gives the same outcome as the FFR, the pressure wire. So that is why we are also now starting the Phase 3 in Europe, Japan, and you're also part of that.
That's actually key. That's actually key. You're completely right. Clinicians want to be really convinced that this technology, that this tool will certainly improve patients' outcome, which is at the end what matters. So, and if the QFR comes not only with practical advantage for the clinician, but also with clinical advantage for the patient, that would be certainly appreciated.
Yeah, yeah. And of course, next step, we want to make things as automated as possible, because every step is one too much.
Right.
And so automation is also key in all these developments, and that is what we are currently doing, and coming up with new versions where every time we will further automate a step. But in the end, images are not always easy to interpret. There contrast, maybe some contour detection. So there will be, really remains a support tool. Don't think it will never be fully automated, but we can try to make it as simple as possible.
Yeah, actually that's important, and we should never forget that the clinical picture is ruling everything. So QFR, like many other diagnostic tools, needs to be integrated within the clinical presentation of the patients and other features that have to be at disposal of the clinician. So full automated system will certainly help adoption, but clinicians should never forget that this information have to be integrated within the clinical picture of the patient.
Absolutely. Yeah. Well, I'm very pleased for you're taking the time to come for the interview. And,
thank you very much for the invitation.
Very much forward to work with you in all these new Italian-based and also European-based studies.
Thank you very much.
Thank you.
Pleasure
again.
to meet you here.
Thank you.
Thank you.